yeah, one of the things that we saw at Royal Perth is that we'd get the Department of Health survey every year, and it's a great survey. We'd hand it to our CAC, and the CAC would have a look at it, give us feedback. We'd get the feedback.
Sorry, I'm just going to interject there. A CAC is the Community Advisory Council, so that's the group of consumers, carers and community.
We love acronyms.
We love acronyms.
And we'd get it, and we'd get it, and then we'd get the feedback. We'd look at it, and we'd put it in these big blue bins marked confidential, and we'd pretty much not do anything with it. But we ticked the box. We did the survey. You know, we're doing consumer engagement. We know how to do it. Doctor knows best. Hunky dory. So we looked at that, and I have to say I've been really lucky. Royal Perth has been really lucky. We've had two amazing leaders. One is Frank Daly, and the other is Aresh Anwar, who were very forward-thinking. And Frank and Aresh both said, we need to hear the patient opinion, we need to hear it now, we need to hear it in real time, and we need to make changes as we hear about them, because the patient experience is the most important thing, because we are a service provider. So one of the things that Petrina will probably talk about when she gets up, because I couldn't do my job at all without Petrina, is we have started sending out our CAC members with iPads to do surveys so that we get real-time feedback, because when somebody like me turns up in one of these with one of these things around their neck, the patients think we're going to turn the oxygen off if they tell us something bad. And it's a fair cop. You know, I'd be worried if I was a patient. So having a consumer go out there and do a survey has a totally different result, to the point where we had staff walking behind our consumer advisory committee members saying, "Can we do the survey as well?" Because they even trust them more than they trust us at the top end of the tree. So we then get that data at the end of the day, so we can actually start identifying what parts of the hospital need work, what the real feedback is. We've also got a fantastic lady in our School of Nursing by the name of Sam Rankin, and I'm sure DOH knows about Sam Rankin. Sam is utilising SurveyMonkey to a whole new level, and has used another adage to that called Cobra. And to the point where SurveyMonkey is so impressed with what she's doing, the American branch has actually asked if they could use Royal Perth Hospital as a pilot site. And we're getting that data fed into a dashboard, and I can tell you this morning that only 17% of our patients in the hospital this morning knew that we had a patient information channel. Yesterday, 23% did. So I can tell right now, if I log in, what our current feedback is from our consumers. So, and I can actually ask Sam, can you actually highlight this area? I want to know about the quality of the meals. Are they happy with meals? So by the end of tomorrow, I could have real-time feedback about what 5 people randomly chosen on every ward thinks of our meals. So it's, while I would love to, and I actually wrote down some notes as everyone else was talking, and I actually wrote down, I feel like I'm a bit of a fraud and a bit of a chameleon, because I hold the title director, but in fact I'm actually being led down a very, very, very interesting pathway by our consumers and by our staff members. We have a gentleman by the name of Ted Dowling, who does a lot of work with Aboriginal patients. And I have learnt more about Aboriginal patients in the last 12 months in my job than I have in the 42 years on this planet, and I'm really embarrassed to say that. Because I'm actually connecting with Aboriginal people from all over Western Australia who are telling me what they want, not us telling them what we want them to have. And I think that's a big difference. And that's the biggest and most important thing about the consumer engagement element that we're doing at Royal Perth, is for the first time, we're actually doing not just consumer engagement and ticking the box, we're actually doing meaningful consumer engagement, and the outcomes are better. So we had an Aboriginal gentleman say to me, "How do you expect me to come into your hospital when I haven't been welcomed?" I'm like, "What do you mean? We've just said, come on in, you're welcome." He said, no, the Whadjuk people haven't welcomed me onto their lands. I can't come onto their lands. So we're now actually going to put a video and a written spiel at the front of the hospital by an Aboriginal elder welcoming people from all over Western Australia onto Whadjuk lands. Little thing, big difference.